Rechallenging or reintroducing FODMAPs is not always straightforward, but it's super important if you follow a low FODMAP diet or you plan to do so. Now, the problem is that a lot of people have difficulty doing this rechallenge or reintroduction phase, whether they're using resources that are now outdated or they seem to react to every single thing that they test. So in this quick video, I want to look at the main culprits that you need to consider if you've been having a difficult time with this or if you're planning to do it soon. But before I continue, I should introduce myself. My name is Joe Leech. I am a dietitian. My website is dietversusdisease.org. I have a lot of information on there about the FODMAP diet. If you want to learn more, you can visit it after this video. Okay, so let's get into the main reasons someone might not get results during the FODMAP reintroduction phase. Now, the first one I've prepared earlier, eating other triggers. So eating other trigger foods. So you need to be thinking about more than just FODMAPs. What else gives you digestive symptoms? Because it's not only FODMAPs for a lot of people. Things to particularly think about is caffeine. Now for me, that is definitely a doozy. That's a big one. Fat, particularly like greasy food. So thinking like French fries, burgers, pizzas, things like that. Spicy food. That's an obvious one. So you also want to keep these to a minimum or to what you know you tolerate. If you're following a low FODMAP diet, but then for some reason you go out and have a really spicy Mexican meal or Thai food or something, even if the ingredients were low FODMAP, if it has a lot of chili, it might give you digestive issues. It just complicates the process. So we just want things to be as straightforward as normal, especially because you are rechallenging a FODMAP. So we do want to test if that's giving you symptoms. We don't want to confuse and confound the results with other variables. And lastly, another quick one, alcohol. Does that still fit on the screen? So yeah, keep those to a minimum. Okay, now number 2 is testing high amounts of rechallenged FODMAPs. So of course the idea is that you have a small amount of a particular food that we know has one single FODMAP, and then you increase it to determine your tolerance, yeah? Now, some people are starting with too high an amount because they're following the traditional plan that they see online, whereas some people are super sensitive and they need to start with a lower amount. For example, if we test fructose, typically recommend 1 teaspoon of honey. For some people, that starting amount could be too high because they might tolerate a little amount, but this is still too much. Or they just need to ease into it a bit slower. They're just very hypersensitive. They would identify as having a very hypersensitive gut. And in this instance, I would recommend like following a plan that's for super sensitive people. So I tell people to have 1/4 teaspoon of honey first and then progress on. So the next day, then you could have half. Then you could have maybe 2/3 or 1 teaspoon. Just something to think about to make sure that you're starting with a small amount and only increasing from there. And you also need to remember if the recommended food amount is not something you would ever eat, for example, 1 whole onion or even half an onion, if you never eat that, then that's okay. You don't need to force that and test for something that you would never eat in that quantity. And number 3 is not remaining on a low FODMAP diet. And that's pretty self-explanatory. You've followed a low FODMAP diet during the elimination phase. When you're rechallenging foods, you still have to stay on the low FODMAP diet, and you reintroduce 1 high FODMAP food at a time, and that helps us determine whether that food and that FODMAP is a problem for you or not. So this must remain the same. You need to have that consistent baseline. So you're following a low FODMAP diet, and you're also making sure these other trigger foods are as per usual that you know that you tolerate, and none of these should vary either. Okay, so I'm just gonna rub these off. So we can fit everything. Okay, we go to fresh board. Number 4 is choosing inappropriate foods. So when you rechallenge a FODMAP group, you wanna make sure you use a food that contains only that one FODMAP or only one main FODMAP. So for example, if we're gonna test honey, like I said before, we'd use honey or mango because they're really high in fructose. If you use pear, it wouldn't be a good choice because pear is high in fructose, but it also has polyols, which are another type of FODMAP. So that would not be a good thing to test because you wouldn't be quite sure which thing you were reacting to. So keep that in mind. You want to make sure that you're choosing the correct foods for each re-challenge that you do. Now, is this all making sense so far? If it is, can you just leave a yes in the comments, or you can like the video. It lets me know that this type of video is actually useful for people. And of course, if you have any questions, you can leave them in the comments of the video and I will try to get to those. Okay, and number 5 is unintentionally changing your routine. Basically, stress is a major factor for digestive issues. Food is a big piece of the puzzle, and that's what I'm all about. That's what we're talking about. But stress and change are other important factors that you must consider as well. So, is this a good time for you to be re-challenging foods? That's the first question you have to ask. You don't want to be changing too many things in your lifestyle or be under stress. You also don't want to be eating, unusually large meals. You don't want to be drinking lots of alcohol, drinking lots of coffee, just changing things up from normal. It kind of overlaps with the first point I made about making sure that you don't have too many of the other trigger foods. If you smoke, you don't want to be smoking a lot. Basically, if your life is right now is a little bit different than it usually is, it might not be the best time to re-challenge. You might want to just wait that out or see that through before you start this phase. And the last point in this video, number 6, medical conditions or additional intolerances. So if you're sure you've been doing everything right and you've been following everything to a T, then we need to consider that it mightn't be just a FODMAP intolerance or a FODMAP intolerance at all. So things you would want to see your doctor and talk about is a food chemical intolerance. For example, salicylates is quite a common one. There is celiac disease. You should have really been tested for celiac disease before you were diagnosed, if you were diagnosed with anything, but before you're diagnosed with IBS, for example. You definitely need to test for celiac disease. We also want to consider IBD or inflammatory bowel disease. Now, it's super unlikely, but I just want to sort of tick all the boxes. These are things that you have to consider. Okay, so to recap, number 1, which is not here anymore, was people are eating the other digestive triggers that they shouldn't. Number 2 was that they're re-challenging with quantities that are too high for what they should be, or they're increasing the quantities too fast. Number 3 was they don't remain on a low FODMAP diet throughout the reintroduction phase, and they of course definitely should. Number 4 is choosing inappropriate foods to re-challenge with, so foods that have multiple main FODMAPs, not just one. Number 5, unintentionally changing your routine, whether they go out for some drinks and have a lot of alcohol during that phase, or whether they're going through a stressful time or a big change in their life, then it's probably not a good idea. And number 6 is having other medical conditions or additional intolerances. These need to be considered as well if you've been doing everything correct for sure and you're still not having any results. If you're just about ready to start the reintroduction phase, or you're looking for some additional assistance from knowledgeable dietitians without actually having to leave your house, then I invite you to check out my FODMAP Reintroduction Quick Start program. Now, this is an online program. Basically, we walk you through how to do the low FODMAP reintroduction phase, and you get direct access to myself and other dietitians to help you along the way. So if that's you, click the link below to learn more. And lastly, if you found this video useful or you know someone who might, please tag them in the comments. And of course, you can share the video if you like. That would be much appreciated. Thank you for spending time with me here, and I hope to speak with you soon.